pharmacists have always been seen as the experts in medication in terms of advising the patient and also ensuring that medication is prescribed and given safely. The job itself is so varied. The application of the clinical skills is really exciting. I think pharmacists are uniquely positioned to use their skills both as experts in medicines and also in the wider team in terms of their communication and their ability to communicate with patients as well, to reassure them that the therapy is appropriate for them at a given time. I think it's really important that patients understand that pharmacists are the experts in medicines.
The pharmacist forms a very important role within the multidisciplinary team within the hospital. They are the first individuals who will look at the medications of the patients, helps in improving patient quality of care and also the length of stay. By having the appropriate medications at the right time, we ensure the patient gets better in time, which also ensures the patient goes home sooner.
An advanced specialist pharmacist has usually developed clinical expertise in a specific specialty, and they then take on an advisory role within that specialism. So it's no longer just about the patients, but it's also about that specialty and how pharmacy can work in the specialty, and also has a corporate role. On a typical day, I will spend about half of my time working on the acute medical wards, which are a very fast-paced environment. I will be supporting the pharmacy technicians in obtaining medication histories from patients. This will involve liaising with doctors, nurses, specialist nurses, dietitians, and the patients and carers. What I most enjoy about my job is that I feel I have the best of both worlds in my current role. So on the one hand, I'm still maintaining clinical contact with patients, and that keeps my knowledge up to date. And I'm actually using all that information that I used at university. And I feel that I make a difference to patients on an individual basis.
What a junior pharmacist does here is rotate within a range of specialities, so different medical and surgical wards, building a strong foundation really in clinical pharmacy within a hospital. Ultimately, the focus is on patient care. So with our critical medicines, it's really important that firstly they're prescribed appropriately and correctly, and secondly that we've ensured the supply so that patients don't miss doses. For example, with Parkinson's disease, it's important that you get the right dose at the right time to prevent any complications of poor treatment. The most rewarding aspect of the hospital pharmacy role for me is going home and knowing that you've actually made an impact on a patient's care, you've improved their care. And actually every day you'll be making clinical interventions. They may be small or they may be big, but they're both equally as important if they're improving the care of our patients. And actually you'll get to a point where you reflect on the ward and wonder how it would actually get by effectively without the pharmacy team input.